Right, Bunty? No?
Show them the needle.
Show him the needle? Oh, well.
That's the needle.
Good girl, good girl.
I used to have it done every day, but now I only have it done once a week. It's not as bad now. You can see where the thumbpricks have been on your thumb. You got little holes all over your thumb. It looks like a pin cushion.
Oh, it's not as bad as that.
Bunty is a 13-year-old girl who's got a very unusual and rare tumour. It's called a rhabdoid tumour, and she presented about 4 or 5 months ago with pain in her back, and after a lot of investigations was found to have a large mass in the thoracic cavity, which wasn't at all possible to remove. And we have tried to shrink it with chemotherapy, and amazingly it appears to be responding, because generally it's a very, very unresponsive tumour, and usually the outlook is unfortunately very poor. Hi. Come and sit down. You're going to sit there and let your mum sit?
My friend bought it for Christmas.
Smart. Come on. How are you?
All right.
Is it true that you went to school?
Yeah,
Very good. How long for?
the whole day. But I went. No, I suppose it's 3/4 of the day.
And how did that go?
All right.
Good. You enjoy it? Didn't knock you out too much? Well, that's good. So have you been again?
No,
We can't.
we couldn't,
We haven't
you
had
know.
to transport.
Right. Okay, did the tutor take you in?
So how long should we staying this time?
This time is... It's just the overnight one, isn't it? Yes.
Just overnight.
Yes, till
I
tomorrow.
go tomorrow.
Yes. It's just because it's just drugs today and then the hydration overnight.
Jonathan Laws is 15 months old. He's just been diagnosed with cancer.
Jonathan's got a tumour called a Wilms tumour. It's on his kidney, on his left kidney, and we found it quite by accident last Friday. We had no idea he had anything wrong with his kidneys, no indication that there was anything wrong, and it was just when I was changing him, I noticed that there was a sort of a, didn't look quite right on this side and felt, and it was quite hard, and just something made me think I'm going to get this checked out.
It's Dr. Jarrett. Could you put me through to the theatre Miss Walker's in? I'd like to speak to her. Jenny, hi, it's Mary. I spoke to Jonathan's parents again this morning, and they've agreed to randomisation. I've randomised him, and he's got early surgery. I haven't told them yet. I was going back up to the ward now to let them know. So that'll be what, 9 o'clock? Yeah. Okay, fine.
Jonathan has been entered into a nationwide study programme. It aims to improve survival rates by monitoring the outcome of every child's treatment.
Jonathan's parents? Is the office free? Not. I think so. Should we take Jonathan?
Why don't you leave him here? We'll look after him, and then you can ask him, and then you don't have to worry about him, and you can ask what you need to.
Yes. I've made the phone call, and Jonathan's to have his kidney removed tomorrow. He'll have the nephrectomy tomorrow morning. He's on the list for about 9 o'clock.
But it definitely would mean his kidney being removed.
Yes, yes. I'm afraid there is no alternative to that, given what the scans look like. What will happen is he'll go down to theatre, and you can go with him, and you can stay with him until he's asleep, and then the operation will take place. And it may take 2 hours, it may take a little bit longer, or it may be quicker than that. Miss Walker will be able to give you a better idea. Sometimes after a nephrectomy, we take children onto the intensive care to monitor them overnight. So So don't panic if that happens.
Okay.
You know, that's often a routine thing that we do.
Miss Walker will be able to see when she looks inside if she can see any possible spread as well.
That's right. If there are any areas inside the tummy that look suspicious, she will biopsy those so that we look at that under the microscope as well. And sometimes things like the glands inside the tummy can look suspicious, and we take a piece of that to look under the microscope. And all of that helps us make a plan for his future treatment.
And his chemotherapy will start
Chemotherapy will start as soon as I get the report from the laboratories confirming the histology. Then I would start the chemotherapy.
So Bunty Cash on the 3rd of the 3rd wants on Dancitron intravenously 8 milligrams prior to a chemotherapy.
The drugs used in chemotherapy are very toxic and are given in carefully controlled doses. The side effects can cause worse symptoms than those of the cancer itself.
You ready then, Bunty? Come on, Trouble. Watch that nose.
Can you give me that thing that itches again?
Well, it itches, you bet.
No, give it very, very slowly and it won't itch, I promise.
Right, we have you.
You've got the 18, Bunty, you should know that.
Where does that line go, Bunty?
Up into my chest and into my vein.
One of the big veins, isn't it, Bunty?
Yeah.
And why do you have that?
Because it saves you from putting a needle in your hand every time. And you can have your drugs through there and they can give you blood through there. And... Oh God, that was the itchy one, wasn't it?
The X one's the itchy one. Just don't do this.
God,
You're right.
that wasn't. Was it the itchy one?
It's fine.
No, it's all like down the back. Everywhere.
Okay, we'll settle in a minute. Okay,
Was it the itchy one? I got another itchy
this
one.
is the itchy one, I think.
Oh God.
I'll do it very slowly.
Very, very slowly.
Don't worry. Just undo it. Okay.
Probably giving me the wrong one.
Oh, Bunty.
Well, I hope not.
You know we check them.
But you heard about that nurse, Beverly Alec. But you wouldn't do that to me, would you?
Of course.
Official bit of paperwork that says that you give your consent to the operation. It says that you also agree to any other measures that are found necessary during the course of the operation. Right. Further paragraph that says that you agree to the administration of an anaesthetic for the operation. Yeah. So if you could just date it and sign it there. All right.
Sounds terrible, Bunty.
Got a polyster.
I certainly know when you're coming.
Within a few hours, the chemotherapy will have taken effect.
Okay.
Has the chemotherapy made you very sick?
First it was very sick. Gave me mouth ulcers first time. I had them all in my mouth and my tongue had come up and everything. It was awful. And the skin was just coming out of my mouth. It's disgusting. And I had to use these little brushes to clean around my mouth. And it's all right with water, but they used stinging stuff. And it really hurt. It's awful.
How do you feel about your hair coming out?
I don't mind.
Was that a shock when it started to come out?
No, because I pulled it out. It came out in bits, like cat fur molting. And it used to come out on all over the sheets, and when you used to take your clothes off, it used to fall out. But I just pulled the rest out.
Now the hospital is a trust, it must balance its annual budget. An overspend is looming, and the domestic services are the first in line for cuts. Unless they can save 20%, they will be put out to competitive tender. And if that happens, the hospital's team of domestics will lose their jobs.
It's ward area C38.
Right, we want to suction clean it every day.
Right.
Check suction clean it every day.
Right.
Damp mop it 3 times a week.
Right.
Check damp mop it 4 times a week. we've been asked by the board that if we can give a cost-effective service by May, we won't have to go out to competitive tendering. So we're now in the process of trying to make sure that each area or ward is cleaned as efficiently and with as low a cost as possible without reducing the level of service.
By lower cost, you mean less people?
It could well be that, yes.
Do you think it should go out to tender?
It's debatable, but it wouldn't bother me in a lot of ways if it did go out to tender, because then I think they'd realise the value for money that they get from us at the moment. They'd perhaps appreciate us a little bit more than they do at the moment.
She's feeling sick. Though she's not sick, but she's feeling sick and she's been throaty, you know. She's not talking much. I think it's after this chemo, she got polio. She liked to eat, but she couldn't because she thinks she'll be sick. So, when she is poorly, I feel poorly like that. No, don't feel.
We worked together 19 years, haven't we, Kath? We live, she lives round the corner from me, yeah. Come to work together. We think,
well, we think, but
between ourselves, we think they'll get rid of nights, you know.
But there again, they said we'll have a job, so
No,
they give us a job,
don't know.
so we're not really
You know, we don't really
worried about
know.
it. There'll be a job at Hendry, I suppose. So
whether it's on days or evenings.
if you accept
We
it, you don't
know.
accept it, they will offer you a job. So I don't think anyone will lose the job
as such.
As such.
You know,
But
it's just nights. What?
it's like everywhere else, I suppose they're saving. But they have told us that we won't be down road, so I don't think we're worried about it.
that.
At the
No,
moment.
no.
Would you be happy about moving to days? Or
No, not really.
No, we wouldn't.
No,
we wouldn't.
not really.
To be honest with you, no, we
No.
wouldn't. We don't want to go on days. We
No.
don't want to go on evenings. We settle now on nights.
Right. Am I going to talk to Jonathan next to the bed? Is there a lot of parents in there? Or... Thank you. Hello.
Hello.
This fellow looks wide awake. Hi. Have we threatened you with no breakfast yet? No?
He doesn't know about that one yet.
Oh, good. The main thing is that it's quite a big operation because it's quite a big lump. But the aim is just to remove that left kidney and to remove any lymph nodes or anything that are around there that look as if they may or may not be involved. And exactly what they show we won't know until they've been looked at under the microscope in the lab.
But the other day when we spoke to Dr. Gerard, she was saying about this a 5% or less than a 5% risk of the tumour spilling.
Spilling.
Yeah. Is that the case with Jonathan?
I can never understand statistics because it doesn't matter if it's 1 in a million. If you happen to have that one, that's relevant to you. But it's a very small possibility that we say it is a possibility, but there's nothing that you can do apart from take extreme care and keep your fingers crossed. A lot depends on how soft the tumour is. All he'll notice when he wakes up is he's got a big scar on his tummy. But you won't mind that, will you? Actually, you'll have a tube down your nose as well, and you won't have breakfast even tomorrow, but never mind. You'll make up for it another day, won't you? Yeah.
Yeah.
It's the best age to be, isn't it? Unbothered by it all.
Yeah, doesn't know what's going on, so... Yeah.
Yeah. Yeah. Fine. Hope you still smile at me tomorrow. OK, thank you. Cheerio. Right. Excuse me whilst I finish my coffee.
You finished your biscuit? There's your plate.
Good job, somebody looks after me, thank you.
I'm going to bed. Good night.
Night.
Shall I turn your light off?
Yeah, where are you sleeping tonight? Upstairs?
Upstairs, yeah. I'm going upstairs.
Right.
Is it alright?
Yeah, okay. Bye.
Well, apparently he's had a cough in the night, and they've had the doctor look at him, and he's got a pussy tonsil. So it may be that his operation will be put off until they're satisfied that he's fit enough to go through with it. So we're just waiting for the anaesthetist to come and examine him again. His chest seems clear, that's the main thing, but apparently under normal circumstances they wouldn't go ahead, but maybe with him they'll have to weigh up the odds and go ahead anyway. So we'll just have to wait and see.
Hello there.
That's disturbing him, that would be good. Hello, sleepyhead. Hello. Can I have a listen again? Hey? Hello. You go back to sleep again? Hmm? The husband's looked in his throat, has he?
Yes, yeah.
Right. Okay, I think I'll go and have a chat with Miss Walker. See what we should be doing.
Do you think it'll go ahead?
I don't know. I think we need to talk first, and I'll come back and speak to you.
Okay.
Right, and there's Bunty as well, isn't there?
She's been having physio to improve her gait. Dave's quite worried about her.
She's not doing any physio at home at all.
They're doing it once a week. She giving her all these exercises to
she
do at
won't
home,
do
she
it.
point blank refuses. She had gained some weight when she came in, only about 300 grams, but beginning to eat a bit better than she had been. She's tolerating the chemo much better than she used to.
I mean, she lost weight the week before, so it's quite good that she's put 300 grams on. I think the third week she is always a lot better.
Yeah, it's like every time she starts eating again, she's due back
I
in
know,
for chemo.
But I don't want to restart the tube feeding at the moment because she's quite happy at present, and I don't want to make her unhappy.
How many more does she want?
Well, I was planning to give her another 4 courses and then reassess things. I mean, I don't know how much treatment she needs, and she's responding to treatment as far as we can tell, so I think we just continue and reassess things. Is that your breakfast? Are you going to eat it all?
I'm only eating the bits with the currants in. I'll work my way around.
Right.
And Drew's back in.
I know. It must have been because you were in, Bunty.
No.
I've not been sick at all. Great. So you want to go home?
They've got an ambulance coming at 7.
This evening?
Yeah.
Right, okay. Make sure, even though you're not being sick, make sure you take the tablets at home because they'll stop the sickness starting up again later on. So take them for at least 3 days, twice a day. One tablet twice a day, yeah. And then come and see me in clinic on Wednesday. And Dave, I gather, has been trying to encourage you to do your physio.
Yeah.
Yeah. Why did I have to send him round? Because we want to get you walking a bit better.
He's coming around every 5 minutes and going around the corner.
That's because he wants you to get... He's on your side as well, you know. Oh, you wouldn't think so. Okay. See you next week.
We need to get this done.
Is it
to give him the best chance?
life-threatening in theatre?
No, it's not life-threatening. It just means it increases his chances of chest problems afterwards, all of which can be dealt with.
Yeah.
Ideally, you'd do him when he's absolutely tip-top, but we haven't got time to wait.
Yeah.
because his head's going to be very floppy. All right. Now, if we can turn him round a little. That's super. Okay, Mum, that's fine. He's asleep now. Okay. Thank you.
So
20%
therefore,
is an awful lot of money.
I know it is. Yes, I know it is. So from a
It's 95,000 and some I've worked it out.
Yes, yeah. So 95,000. So we're looking for a domestic services contract to the tune of £395,000, and we need to consider how we're going to achieve that target.
But I'm genuinely concerned that in 6 months' time, what sort of state, cleanly-wise, will the hospital be in? And if we're wanting more people to come here, their first image is as they walk in the door or as they visit the loo or something like that. Well, it's going to put them right off. I'll do it, but I'm not happy.
Yes, yeah, I know you've expressed that.
I know the savings can be made.
How much do you think we can reduce it by?
We ought to be able to reduce it by a bit because our main money spinner is nights. Well, if I can talk theatres round, we can come off a night clean and go on to a morning clean. So we can make savings, but I don't know whether we can make 20%.
Right.
Are you working from this side?
Yeah, this side. Hang on. Right angles, please. Right angles, tap, a bit more. There's the lump. You can see it quite nicely, really. You can see that it's that sort of solid lump there. Mum just bumped into it one day. That side's all squidgy and that side's quite solid. And you can see that. And that's how she found it. Thank you. And it's quite small. In fact, sometimes the lumps get even bigger before the parents notice it. Some of them are really enormous. Scissors, please, thank you. There's the colon, and that's the tumour there, that big lump there.
Start on skin till we draw all that cystoscopy.
I haven't got to the other side of it yet. But the liver feels clear. But we know that from your CT.
Can we get the scales, please? We'll bag them individually and then bag them in
Kidney's the normal size, but then you told me that on your CT as well. Long scissors to Ali, please. Just cut that, that's the first bit that's gone. Yeah. Right, marvellous. Come on out, you little thing. It's a good sized grapefruit, isn't it?
Yeah. You wouldn't want it on your breakfast steak, would you?
See, that's the tumour there, and that's normal kidney up there. Or it was, and obviously it's so closely attached to the tumour that you have to take the whole thing out. And you're just, yep, lovely. Thing is that we need 3 hands at this moment, so we'll have to use Chris. Yes, please, thank you, Alan. Don't let go, as they say.
Right. Are you ready for this?
Yeah.
You better smile all the time. Okay. No, it doesn't.
It does.
Oh, no, it doesn't. Pain never hurt anybody, Bunty. Just relax and smile. When Bunty was in hospital earlier, when she was more poorly, she had a habit of sitting in a bad position, and that she would sit curled up with her knees bent and her feet pointing down, and she would sit on them. So the back of her legs had become very tight, her hamstrings had become tight, and her Achilles tendon has become tight. So it's making her walk in a funny way. Well, I think it's funny anyway. So if you can stretch them at the back and make them a bit looser, she'll be able to use her muscles at the front to actually pull her foot up so she can walk better. So she'll look like a lady when she's walking instead of a duck that she looks like now. And relax.
You're not doing it as hard as you normally
I'll try. Well, I don't want to hurt you. You don't want tears, do we? And why have we got to do this, Bunty?
Because my legs are perfect.
Because your legs are perfect, that's right. We're just trying to make them even better. It's because you don't do it yourself, basically.
But if you were physiotherapy, you wouldn't do it every day.
I would. I'd be doing it 100 times a day. I would, because I know what's good for me.
Okay. I'll see you in a bit.
Okay.
Is everything all right? It's fine, yeah. He's fast asleep. He'll probably be quite sleepy for a while after his anaesthetic, really, yeah. It's okay.
His tummy looks a funny shape.
Yeah, I think it's just because he's on his side, he's a bit squashed up, really. He's got lots of wires and things attached to him, but they're all just so that we can keep a close eye on him and they'll come up on the screen.
All right.
Just his heart rate at the top. Sometimes they sleep for quite a while after the anaesthetic. You know, he could be knocked out like this for the whole day.
He looks quite happy.
I'm amazed how well he looks.
Yeah, it's fine for him. The parents that always suffer
That's
more.
right, yeah.
The tumour itself was quite confined to the kidney, but I don't know whether the lymph nodes are involved till the pathologist looks at them. But there certainly wasn't anything else. It wasn't outside anywhere. And it came out in one big lump.
Good. That's wonderful.
Okay.
Thanks very much, Miss
All right.
Walker. Thank you.
Thanks.